Hello everyone. So I'm Dr. Neha and welcome back to another episode of Super 5 PSM MCQs. So before I begin, Unacademy has come up with an amazing offer where you can get 20% off on your NEET PG subscription. It's a limited period offer. We offer you concise and crisp content for revision, fully renewed Q bank, and in-class doubt solving sessions also. All you have to do is use code PSM live to get 20% off on any Unacademy subscription that you want. A lot of batches have also started. I'll be briefing you on that. And there is another 15% plus 20% additional on NEET PG plus subscription. All right, so it is a limited period offer. If you're looking to take any of this, if you're looking to take any of this subscription, it's a good time now because you can get, if you plan to take, let's say, a 6-month subscription, the offer price is 15,300, but you'll be getting the offer price is actually 22,500. You'll be getting it at 15,300. Plus, you can also opt for the iconic subscription. Iconic subscription is Prep Ladder and Unacademy both. So like 6 months, it's 36,000, but you'll get it for 9,000. So all you have to do is use my code PSM Live to avail this offer. And what's best is on 7th of September, an academy has launched a new question bank which has 18,000 plus case-based questions and image-based questions to help you in your preparation. Also, there's a system-wise integrated batch which has just started, so you can still become a part of that. For PSM, the batches in the month of September, there's a revision batch for FMG students, there's a TND batch happening, there's also an INI-CT batch happening. So avail these batches, get the advantage of these batches. All you need to do is subscribe, and now is the good time to subscribe. Use PSM Live and get up to 20% off. So let's start with the first question. In vaccines, incorrect matches. You have to find the incorrect match. This is a question of strains of vaccine. This is a question on strains of vaccine. So if you look over here, if you talk about, let's revise some common strains. Dengue ke liye it is CYD TDV. Then if you talk about measles and if you talk about mumps, both start with an M and both have fancy names as strains. Like measles, we have Edmonston Zagreb. And mumps, we have Gerald Lindstrom. Okay. Then for vector-borne disease, we have numbers like Japanese encephalitis. There is SA14-14-2. So this is a live vaccine, right? For yellow fever, we have 17D. Other than vector-borne diseases, where is the number? Rubella. RA27-3. Typhoid. Typhoid is what? Typhoid is TY21A. So these are some strains of the vaccines that are important. Influenza. If you talk about the kill strain, it is A7 California 2009. A pandemic of influenza happened in 2009, so that's how it is being named as A7 California. So measles over here is Geraldine? No. Measles is Edmonston diagram. Rubella is Copenhagen? No. Copenhagen was a strain of BCG. Okay, ideally BCG is Danish 1331, but Copenhagen also for BCG. Mumps, Schwartz? No. Schwartz and Moratin. There are two strains, Schwartz and Moratin. Schwartz and Moratin are both for measles, but no longer used. Okay, no longer used. Now the strain of measles that we use is Edmonston Zagram. Yes, chickenpox, Soka, absolutely correct. Polio, Solkin Sabine. So oral polio vaccine, if we talk about, oral polio vaccine is live, discovered by Sabine. And IPV is injectable or killed. So this was discovered by Salk. So these two are absolutely correct. So what are the incorrect options here? A, B, and sorry. The incorrect options are A, B, and C. So in this question, you revise some important strains also which can come in your exams. Okay, so A, B, C are incorrect. You must remember these few important strains which can come in your exams. Patient on psychotherapy, what is the level of prevention? So we all know there are four levels. Primordial. Primordial is before risk factors. Okay, so before risk factors, primordial, how do we achieve it? By health education. Okay, then you have primary. Like if I say don't start smoking and drinking, that is primordial. Primary means risk factor present, okay, but disease not started. So you already smoke and drink. So I will say stop smoking and drinking. This is achieved via health promotion and specific protection. Okay, then we have secondary level of prevention. What is secondary level? Secondary level is disease has started. Okay, disease has started, but it is still reversible. No complications. Disease started, but no complications. And how do we achieve secondary level? By early diagnosis and treatment. All right. And there is one more, tertiary level. So what happens in tertiary level? Disease has progressed. Disease progressed to irreversible stage. That means complications are present. Okay, complications are present. And how do we achieve tertiary level of prevention? Via disability limitation and specific protection. These are the two ways we achieve it: disability limitation and specific protection. So if you see psychotherapy, it's actually a form of treatment for mental illness. So since it's a form of treatment, everybody, where do you think it is going to go? Secondary level of prevention. Okay. All right. Primordial is when no risk factors. Primary risk factor present, disease not started. Secondary, disease has started but no complications, so early diagnosis and treatment. And tertiary is disease has progressed, complication present. Okay, more sensitive index for surveillance of malaria transmission. So an index for surveillance of recent malaria transmission. Okay, if they ask you on malaria transmission, it is infant parasite rate. Here we are talking about epidemiological indicators of malaria. Okay, epidemiological indicators of malaria. So when you talk about this, we refer to eradication era, pre-eradication era, what do we use? And in the eradication era, everybody, what do we use? Okay, pre-eradication era and eradication era. So in pre-eradication era, we use spleen rate, very important. We also use, okay, average spleen rate, okay, but more important is spleen rate. And we use infant parasite rate, which is the answer over here, parasite rate. Proportional case rate is also used. Eradication API. API is annual parasite incidence. Then we also use ABER, annual blood examination rate, SPR, slight positivity rate. These are some of the important indicators. Now I'll just tell you about a few, like spleen rate. Spleen rate is what? Children 2 to 10 years who are showing what? Enlargement of spleen. And spleen rate is a measure of endemicity of malaria. Okay, it is a measure of endemicity of malaria, whether malaria is endemic or not. Okay, so 2 to 10 years showing enlargement of spleen. Infant parasite rate is the blood slides that are examined for infants. Out of them, how many are positive? Okay, blood slides examined for infants. All right, and out of them, how many are positive for malarial parasite? So infant parasite rate is an index of recent transmission of malaria. Okay, that is again very, very important. Then you must know about API, annual parasite incidence. Okay, it is annual parasite incidence. What is API? Total population. Out of them, how many are positive for malarial parasite? MPS, malarial parasite. Let's write it down. Malarial parasite. And this is an indicator for burden of malaria. All right. This is an indicator for burden of malaria. Then we have ABER. ABER क्या होता है? This is annual blood examination rate. That means from total population, how many blood slides prepared or how many blood slides examined. Here the multiplier is 1000 in incidence, here it is 100. So ABER is an indicator of operational efficiency of a program. All right, and after that comes slight positivity rate. What is slight positivity rate? So slight positivity rate is what? Slight positivity rate is total slides examined. Out of them, how many are positive for malarial parasite multiplied by 100. This is an indicator, or this is used during outbreak of malaria. All right. So what did we just study? Let's have a look. In epidemiological indicators, pre-eradication era, spleen rate, average and large spleen, or infant parasite rate, eradication, API, APER, SPR. So spleen rate is children 2 to 10 years showing enlargement of spleen, measure of endemicity. Infant parasite rate, blood slides examined for infant, how many are positive for malarial parasite. Recent transmission. API में देखो total population, how many positive, burden. ABER, total population, out of that how many blood slides examined, operational efficiency. Slide positivity rate, total slides examined, out of them how many are positive, outbreak of malaria. Okay. Let's go to another one. The term disease control refers to operations aimed at reducing all of the following except. It definitely aims at reducing incidence, financial burden, prevents complication, not virulence. Okay, we are not talking about the killing power here. When I say control, please remember we have to reduce the new cases, which is the incidence. We have to reduce the modes of transmission. Okay, we also have to reduce the financial burden to a community and complications, so long so that the disease no longer remains what? Disease no longer remains a public health problem. All right, that is what is control. Okay, the buzzword here is reduce. But if I interrupt the modes of transmission. So if I interrupt the modes of transmission, okay, but agent is still there. Agent exists. Okay, this will be known as elimination. But if agent not there, okay, if agent not there, this is eradication. Remember, elimination is a regional term. We talk about eliminating a disease maybe from a country or a WHO specific region. But if I talk about eradication, everybody, it's a global term. But like from the entire world, a disease will go. But control is you have to reduce. You reduce. Like if suppose TB cases were occurring 100 per thousand population, now it's occurring just 1. So that is control. We don't talk about virulence over here. Okay? One more question. What does the following image represent? Actually, it should be identify the image. Okay, so identify the image, then I'll tell you if it represents publication bias or not. So what is this? Forest plot, funnel plot, blobogram, any of the above? This is a funnel plot. So what are the questions that come? Funnel plot is drawn in case of a systematic review and also meta-analysis. Okay, then it represents what? Publication bias. Now here you can see These dots, they are studies, and if the dots are scattered, no publication bias, but if they are clustered at one end, then publication bias is present. So here the dots are scattered, no bias. What is a forest plot or bulobogram? So everybody, a forest plot is drawn in case of a meta-analysis only, all right, not a systematic review, which represents the overall effect size. Okay, overall effect size. This over here is funnel plot. Okay. So that's it for today. I hope you will remember these things. And before I finish, please remember An Academy is giving you an amazing offer, 20% off on your subscription. So what are you waiting for? Grab the opportunity now. Use code PSM Life. Thank you so much. See you soon.